Adhesive skin traction. Adhesive skin traction attaches an immobilizing device to the skin to treat leg fractures. Non-adhesive traction. Non-adhesive skin traction uses cohesive bandages that stick to themselves but not to the skin, to secure the traction force. Fixed traction. Fixed traction exerts a force against a fixed point using a splint or gravity. Halo traction. Halo traction is skeletal traction to the head to treat cervical spine trauma. Head halter traction. Head halter traction stretches neck vertebrae and muscles for short-term immobilization of cervical spine problems. Skeletal traction. Skeletal traction is applied to pins that are passed through a bone in the lower limb. Bryant's traction. Bryant's traction uses two overhead beams and gravity to treat fractured femurs in children under the age of 18 months. Thomas splint traction. A Thomas splint is used with skin or skeletal traction to immobilize fractures of the femur. Hamilton-Russell traction. Hamilton-Russell traction is a type of balanced traction used for fractures of the femur. A sling under the knee exerts upward force while horizontal traction is applied to the tibia with weights. Traction apparatus. Traction apparatus is the equipment used to set up different types of traction. Balkan beam. The Balkan beam is a rectangle frame that is positioned over the bed, used to attach traction apparatus to, for example, weights and pulleys. Pulleys. The pulleys of the traction apparatus should be free running. Knots. Traction cords are attached securely by non-slip knots. Weights. Weights should not be hung directly over the patient and should not rest on the floor. Crêpe bandage. Remove crêpe bandages once a day to wash the limb and observe the skin. Calico sling. A calico sling is a fabric sling that supports the limb along a Thomas splint. Monkey pole. A monkey pole enables patients to move in bed, helping to prevent pressure ulcers. Countertraction. Countertraction is the force acting in the opposite direction to the applied traction. Plantarflexion. Plantarflexion describes positioning the foot with the toes furthest down, e.g. standing on tiptoes. Dorsiflexion. Dorsiflexion in the ankle occurs when the toes are drawn back toward the shins. Compartment syndrome. Compartment syndrome is a painful buildup of pressure around the muscles. Foot drop. Foot drop is caused by an injury to a nerve that runs down the leg and controls the muscles that lift the foot, so that it's difficult to move the foot and walk properly.